Welcome to the Pain-Free Movement. This channel is for those affected, frustrated or annoyed by musculoskeletal pain. Pain from injury, pain in joints or muscles, pain in backs and necks. This program has one simple goal: to help you sort out your problems. What is the single most important thing? I'm Max Kavanagh, a physiotherapist in Adelaide, South Australia. It's a world of confusing messages out there, and the single most important thing is your health. This program will address all aspects of healthy, pain-free movement, but with one goal: making it simple. If you're watching now, you're probably in pain from an injury or have a loved one who's dealing with it. What do we need to know about injuries? We've all had injuries, some minor, and many of us have had significant injury too. If we have a fall or an accident, it seems straightforward, but sometimes it's not as obvious to us why our pain starts or gets worse or recurs. It can be confusing and frustrating. What is the single most important thing about injury? Most clients come to us because of an injury and the pain it causes them, and it's commonly described in this way. Injuries occur when the load of our tissues is greater than the capacity to cope with it. Now, in the case of our bodies, the loads we have to cope with are not just the weights of objects we lift. It's many things. It includes the range of movement our joints are put through, pressures we're put under, or how many times an activity is repeated, and so on. Our body parts all have varying abilities to cope with each of the pressures to which they're exposed. And if the load is beyond the ability to cope, then damage occurs. We get injured. So the equation is a simple one. It's pretty obvious to us when we have an accident producing a traumatic injury. If you stand up quickly and bump your head on a cupboard door, the sudden load is too much and too quick for our tissues to adapt, and we bruise or cut our head. The same thing happens if we tread in a pothole and twist our ankle, stretching the ligaments past their normal capacity to hold the joint together. The tissue tears as we suffer a sprain. But actually, most injuries we get are not as clear-cut as those examples. Most of the injuries we see are atraumatic, meaning we may not see a logical reason why it has developed. Some injuries sneak up on us, like a stiff neck, or they might just gradually get worse, like knee pain with stairs. Or some injuries may seem really disproportionate. Shoulder pain from tucking your shirt in or just reaching. I've seen many people who have severe back pain from very simple events, such as reaching into a cupboard. I've even seen people with dramatic spinal pain from simply sneezing. Have you ever thought about that? How come significant injuries can occur from things you've done 1,000 times before? Well, we tend to justify it by thinking it must have been the way I did it or the position I was in. But that doesn't really make sense. Our bodies are indeed amazingly able to adapt to loads over time, but common sense tells us that it can only cope with so much. If we keep pushing the limits, we're eventually going to be in trouble. The fact that we get significant injuries that sneak up on us, or when we haven't done anything that is obvious, only makes sense if we understand loads may build up over time. And finally, we push past our body's capacity to take it. And the irony here is that because we then move into the inflammatory cycle, having finally damaged the tissue, we start to feel pain. So intuitively we think that's when the injury started. When in actual fact the load's been building and building until finally we get to the point where the straw literally breaks the camel's back. If we put ongoing strain on tissues or our movement patterns aren't efficient, then the tissue's capacity is pushed to its limit until something pushes past the ability to cope. Now, I call this summation. In most of these situations, when we feel pain, it's a delayed event. By the time we reach that point, the injury has been building up over time. So this is where we can really help ourselves. If we are to avoid these injuries, we have two options: keep the loads less than the tissue capacity, or increase the capacity of the body to take the load. Generally, I use the simple mantra here to help. Too much, too soon, too quickly. Injuries result from one or a combination of those three factors. The good news here is that our body has a great ability to increase our tissue capacity. We can build muscle strength with exercise, tissue length with a stretching program, and even our bones can get stronger with activity over time. But too much, too soon, too quickly, and we're in trouble. Too much could be taking on the paving job on your own, or painting the eaves when overhead activity is not for you. Too soon could be getting straight into jogging rather than starting with some walks, or returning to stairs at work before the calf strain is fully healed. Too quickly could be pruning all the roses at once when you have a family lunch to get to, or arranging a walk with a friend who you discover is a power walker. So firstly, we can manage the load. We can be smarter by being aware of the loads we're exposing ourselves to. Keeping them in reasonable limits, planning activity and not rushing things will help you. And what about our capacity of our tissues? Well, our body has the ability to adapt to what we ask of it, but it doesn't happen quickly. We can increase our capacity for load by gradually building exercise or physical activity, but you have to give it time to do so. We can step up weights or walks or gym programs in a controlled way. The time needed will vary according to your starting point and your goals. Now, this is where getting great advice from an expert is very important. And your tissue capacity can also decrease for many reasons too. With stress, illness, or a drop in your usual activity levels, your tissue capacity lowers. If we suffer an injury, we have to decrease our activity, proportional to the severity. And we are often mistakenly told to go home and rest. The speed and degree of our loss of capacity is greater the less active you are. In fact, multiple research studies show we start losing cardiorespiratory fitness within as little as a week or so when we drop our activity levels. And our muscle strength also behaves similarly. You've heard the saying, if you don't use it, you lose it. It happens so much quicker than we all realise. This will leave us vulnerable to re-injury and also injury to other parts of our body too. This is why we want to try and keep as active as we reasonably can, even when we have an injury. So, understanding these factors and being aware of that load versus capacity balance shows us the need to allow time for our body to change, adapt and cope. So this week, I want you to analyse your daily routines. If we consider the build-up of load on our body, we need to assess what we're doing during the day. We generally think sitting is resting. Actually, in the last decade or so, research is opening our eyes to how bad sitting for long periods is for us. Governmental bodies such as Safe Work Australia are spreading the word. Occupational sitting is linked to significant negative health and work outcomes and is increasingly being recognised in the community and by international authorities as an important issue that needs attention. Musculoskeletal and metabolic experimental and epidemiological evidence supports the benefits of keeping sedentary task bouts to no longer than 20 to 30 minutes. The Heart Foundation tells us it's very easy to sit too much. Adults spend more than half of their waking hours sitting. Therefore, to reduce your risk of health problems, it is important to be aware of how much you sit and try to move more throughout the day. In fact, we have a whole episode coming up soon on the effects of sitting, and that will astound you. So your task this week is to write down the amount of time in the day you're sitting, standing, or being active. How much time do you spend sitting at a desk? What about driving or travelling? How much time do you spend watching TV or eating at the dinner table, or online browsing, or scrolling through social media? Write down the sitting time you're doing in the day. How much time being active, walking, gardening or cleaning? How much time standing in meetings, cooking and so on? Let's work out your average over the week. It may seem funny, but the loads on your body might be related to non-activity. If large parts of our day are sedentary, then our capacity will diminish. And well-intentioned as it may be to punch out a gym class or squeeze in a huff and puff exercise session to compensate, we may be putting ourselves at greater risk of injury. Remember, too much, too soon, too quickly. Getting the balance right is the key. We have to respect our body needs time to build capacity. We need less strenuous, more regular activity to build up capacity over time. When we get injuries, it is common to blame the activity we're doing, and then we stop, so the capacity drops even further, which worsens the imbalance. And we continue on a downward spiral. So I see many people, despite trying to do what they think is the right thing and improve their fitness, get injuries, get frustrated and give up. We throw the baby out with the bathwater and nobody wins. So there's much more to injury than we think. But with all that I've explained today, what is the single most important thing? What is the single most important thing we need to know about injuries? Summation. Most injuries we get are the end result of the summation of loads on our tissues overtaking their capacity to cope. But with that knowledge, we can start to help ourselves. And next week, we'll discuss what we need to know about healing your injuries. For all of you that are frustrated with pain, wanting to truly fix your injuries or wanting to prevent the problems in the first place, the pain-free movement is the program for you. So take action today. If you haven't already, give us a like, ding the notification bell, hit the subscribe button and join the pain-free movement. Because the single most important thing is your health. I'm Max Kavanagh, wishing you good health and pain-free movement, and I'll see you next week.